Over the last several weeks, we've seen a significant increase in the total number of cases, both in the community and also in the hospital as it relates to pediatric COVID cases. We've seen a pretty remarkable increase in the number of pediatric hospitalizations associated with this current wave of COVID, both on our general pediatrics floor and within our intensive care units. Over the last few weeks, we've certainly seen a significant increase in the number of cases in the community, and that has fueled the increase in number of emergency department visits and inpatient admissions that we've seen, and certainly cases are continuing to climb, particularly over this holiday time. Most of the cases that we're seeing that require hospitalization are in the unvaccinated patient population. So either children that are too young to be vaccinated or those that are old enough and just haven't been vaccinated. We've seen that many children will have mild cases of COVID, as we've seen over the last almost 2 years, but certainly we don't want to dismiss those children that can get severely sick. There are children who can have severe symptoms and require hospitalization, require ICU level care. This is not the majority of children, but certainly it's important to remember that many children will become sick and will require health care to some degree. And there is the potential for severe illness, and we just don't know as much about this current Omicron variant in pediatrics to know whether we can say safely this clearly isn't as severe of an illness, because what we're seeing in the hospital shows us that it can produce severe illness in pediatrics. MIS-C, or multisystem inflammatory syndrome in children, is a post-infectious entity. So it occurs approximately 3 to 4, maybe 5 weeks after an acute COVID infection. And it can cause a host of symptoms. Typically, children will come in with pretty significant illness, many of them requiring ICU level care. MIS-C can produce different types of symptoms in different children. So each child presents differently. Some things that may be present include fever, swelling of the hands and feet, sometimes a rash, sometimes the eyes will look red, and they can have GI symptoms is a pretty significant finding that we've been seeing in many of our children. But sometimes those symptoms that you can see with your eyes are not present, and that doesn't mean that the child can't have MIS-C, and it becomes more evident when we do lab testing on the blood where we can figure out what's going on. We have been seeing MIS-C cases coming into the hospital. It's very difficult to know what this Omicron wave in conjunction with an ongoing Delta surge will produce in the coming weeks. The best things that we can do to protect our children as parents go back to those foundational principles of hand washing, distancing, and masking. Certainly sending our kids to school with masks, and not only masking, but masks that fit well over the mouth and the nose, and having children go to school with an additional mask or two in order to exchange a mask that might be soiled. So it's really important. The quality of the mask fit is really important too. But as children go back to school after this holiday time, it's really important to maintain those foundational principles that we've been relying upon throughout this pandemic.